Hi, I am Dr. Brahmaraju, consultant orthopedic and joint replacement surgeon at SPARSH Hospital, Mysore Road. Today I am going to talk about osteoporosis. What is osteoporosis? It's nothing but weakening of the bones, which there is a structural deterioration in the bone, which leads to fragility and susceptibility to the fractures. Osteoporosis is widely prevalent throughout the world, and in India, the prevalence is on the rise. Women tend to have more osteoporosis than men. So what are the symptoms osteoporosis gives? Osteoporosis is called a silent disease because it rarely gives symptoms. However, there are some early warning signs which one need to be aware of, like receding gums, brittle nails. They may have easy fatigability, they may have bony pains or muscle cramps. In some people, they notice progressive loss of height and some humpback deformities. So what are the causes of osteoporosis? It's mainly divided into primary and secondary. The primary may be senile, that is age-related osteoporosis, or postmenopausal. The secondary reasons for osteoporosis include people who take less calcium, vitamin D in their diet, people who indulge in excessive smoking and alcohol consumption, or people with endocrinal disorders where there is hormonal imbalance. Okay, so what are the presentations, how we diagnose osteoporosis? Like I said earlier, it is a silent disease. We need to have high index of suspicion. However, there are certain class of people who are prone to have osteoporosis, whom we have to sort them out. So like people who are postmenopausal age group, those who are excessively obese, those patients who are on cancer therapy, or those patients who are taking long-term steroids or anti-epileptic medicines. And also, women during pregnancy and lactation are prone to develop osteoporosis. So the main investigation for diagnosis of osteoporosis is a DEXA, which is a gold standard. It helps in quantitatively assessing the bone mineral density. So how do we prevent osteoporosis, which is more important than treating the osteoporosis? So prevention is mainly following a healthy lifestyle. We should expose to sunlight every day at least for 15 minutes. We should regularly do physical activities at least 30 minutes in a day. And people who indulge in smoking should quit smoking, and the alcohol consumption should be moderate, and the chronic medical diseases like diabetes, kidney disease should be under control from the beginning. And also people who are like a high risk group should take at least 1000 milligram of calcium every day. Coming to the main treatment part, there are anti-osteoporotic medicines, different kind of medicines what we use, like bisphosphonates. We may use calcitonin, we use teriparatide, or immunological agents like denosumab. Coming to treating these fractures, which is a highly challenging situation for the orthopedic surgeons, one should be very skilled and competitive, and we should use specific implants to fix this fracture. Our main aim is to make the fracture heal early and get back the patient to normalcy at the earliest. I hope the following information was informative. Think of healthy bones, stay happy, stay healthy. Thank you.